Hello, everybody, and welcome back to the 30-minute mission. This is Andrea Twarowski with Dentalelle Tutoring, and this will be a good 30 minutes. It might not be a full 30 minutes, but it's going to be pretty close. My emails that I have received, I'd say the past 2 weeks, are just basically some common questions about what do I do if a patient asks me this, or what do I do if the patient says no to x-rays? What do I do if the dentist says the patient needs a crown and the patient looks at me and says, do I need a crown? So I'll be talking to you about a few of the more common questions that patients do ask, but as a new dental hygienist or even dental assistant, you might not really know how to handle it. And you want to sound like you've been at the office for years, not, this is your first day or two. There's nothing worse than saying, oh, you know what, I actually don't know. This is my first week, or I don't know the answer to that question. This is my first month, or this is my first couple months, or whatever. Even if, you might have heard me say this before, but even if you don't know the answer to something, and I've been in practice now for 11 years, it does happen where they ask me a question and I don't know the answer. I will give them my best possible answer. You will never hear me say, I don't know, or you will never hear me say, I couldn't tell ya, or, any of those not so professional things that I do sometimes hear new dental hygienists or dental assistants say. Even as a quick example here, one of the dental hygienists in my office will be away for the next month and a half because she's had surgery on her foot. So we've had a lot of new dental hygienists come in, and some of the things they say sometimes I'm just like, oh my goodness. But on the other hand, though, some of them are pretty darn amazing. And I think to myself, oh, wow, you've only been a hygienist for a month. I wouldn't know, because it's just the way they talk. It's the way they interact with patients. It's so important to sound like you're a professional. Even if you're nervous, even if you don't know what you're talking about, it's still such a good idea to sound like a professional. And I heard a new dental hygienist say the other day when the patient had asked, well, I don't really want x-rays today. Is that okay? So it kind of sounded like the patient was asking the dental hygienist if that was okay to not have x-rays. And she pretty much said, well, I don't know. The dentist wants them. I probably should take them. And that's exactly how she sounded. And that's exactly what she said. And if I was the patient, I'd be thinking, okay, you're exposing me to radiation. You don't really sound very professional here. I don't want the x-rays now more than ever because you're also basically telling me there's no reason to take them. It's just because the dentist wants them. So, you could interpret that however you want, but that's kind of what I felt and how I felt. I couldn't really listen. I was so tempted to stop what I was doing. I was cleaning somebody else's teeth, but I was so tempted to stop and be like, let me explain to you why the x-rays are so important, or let me explain to you the pros and cons, and then you make the decision yourself, because ultimately it's up to the patient to make the final decision because it's their life, it's their mouth. So what I'll be talking to you about today are some of the more common questions that patients may ask a dental hygienist and even a dental assistant, so either or, because you will find as soon as you start practicing, the dentist will say one thing, and then as soon as the dentist leaves the room, they will turn to you and say, so what should I do? Whether it be the dentist tells them they have a cavity, the dentist says you need a crown, the dentist says you need a bridge, the dentist says we need to take just 2 more x-rays or something along those lines. So let's start with number 1 here. So I want to talk to you guys about the most common, question or statement that a patient will say. And it goes back to my first point in that first example, is the patient will either say to you, you know what, I don't really feel like x-rays today. How about next time? Or, well, I don't really like that the x-rays expose me to radiation, so I don't want them. Or, well, you took x-rays just last time, I don't want them. So to help the patient through this, just please keep in mind that in the end, it is up to them. Don't yell at them, don't force them to take the x-rays, but you should let them know the pros and cons. So depending on how they say no to the x-rays, if they say no because they don't have the money, because they don't have the extra $33 or however much it is to take, let's say, 2 checkup x-rays. Telling them the pros and cons of x-rays doesn't make sense because that's not why they're saying no. They're saying no because of the cost. So if they're saying no because of the cost, I suggest speaking to the dentist and saying to them, Mrs. Smith has said no to the x-rays because of the cost. Is it okay with you if we, say she can leave a post-dated check up to a week or 2 weeks or a month, however your office handles it, because these x-rays should be taken? Or the dentist could even say, well, if cost is an issue for her, I still would like those x-rays taken, so we won't charge her for half, or we won't charge her for the x-rays today. It does depend on the dentist, and I'm not saying to offer the x-rays for free because that's not really up to you. But if the dentist truly and sincerely wants those x-rays, but cost is the main factor, there are certainly things you could do, but it does depend on your office and it depends on the dentist. In my office, if cost is a factor, I do tell them, these x-rays are still important. I do understand that cost is a factor. We are happy to accept a post-dated check up to a week if that helps. Or, even I might say, well, how about then we take the checkup x-rays next time? These 2 checkup x-rays would be an additional $35. So if you could please save up enough money for that, that would be excellent. Now, some of you may be thinking, it's only $35. That's pretty silly that they're saying cost is an issue. But we're not the ones to really say that. And we aren't the ones to think that, because $35 may be a lot to that person, right? You just never know. Or cost could be an excuse. It's hard to say, but you should never think, oh, well, $35, that's all it is. She's just saying that because she doesn't want me to take x-rays. And that may be the case, but don't try to focus on that. Another thing with regards to x-rays is, well, I've heard from this talk show or that talk show that the dental x-rays are harmful. There's a lot more radiation with them, so I prefer to not take them. In my experience, if that is what they say, then even if you ask them if you can take the x-rays next time, they will say the same thing and they will say no. And then 5 years will go by and you still haven't taken those checkup x-rays. So to nip this in the bud, I'm completely honest with them. And I say, yes, that's true to some extent. The dental x-rays here, yes, we do expose you to some radiation, but it's even less than if you go outside in the sun. And then I stop and they may think about that, or they may look at me like I'm crazy. And then I say, if you enjoy traveling, every time you take a plane, that's exposing you to radiation. And that's a lot more than taking these x-rays today. And then they'll stop and think about it. And then if they're still not sure, I'll say, plus, in our office, we have digital x-rays, which actually exposes you to 50 to 80% less. So that's pretty good. So if that's their main concern, then I would just keep on saying things like that. But if that doesn't seem to be helping them, then at the end, and ultimately, I will say, these x-rays are needed so that we're not missing anything important. If I don't take the x-rays today, you could have a cavity in between the teeth where we can't see it. It may become larger and then you could be in pain. I'm not saying that's happening, and I am hoping that that doesn't happen, but that is why we take the x-rays every so often, depending on the patient, because we don't want to miss anything. And in my experience, if we don't take the x-rays, we may miss something very, very important. Now, usually, I've never had a situation where they still say that they don't want them. That usually helps them. I guess the only time where I would say, if the patient says that they don't want them, if they've been to the hospital, let's say, recently, and they've had CAT scans, they've had ultrasounds, they've had all kinds of things, they have been exposed to a lot of radiation, and you probably learned that in school, that if they have been exposed to a CAT scan or an ultrasound or an MRI, that's a lot of radiation, and they actually shouldn't have x-rays with you for at least a year or two, depending on the type of tests they've had in the hospital. So I do have that sometimes where the patient says, I really don't want the x-rays today because I've been in the hospital recently. They took a lot of x-rays. I'd prefer to wait until next time. That to me makes sense. But let's say their tooth or teeth or something are extremely sore and you suspect they may have an abscess or an infection or something. Even if they've had been exposed to a lot of x-rays, to really help with their tooth pain, you would probably need to take an x-ray anyway, because unless you do, you can't tell where the pain is coming from. So the checkup x-rays aren't absolutely needed if they've been through a lot of x-rays, let's say at the hospital. But if they're coming in specifically for tooth pain, then I would say to them, you know what, I do understand you've been through a lot of x-rays, but in this case, I only want to take an x-ray of that specific tooth or those specific teeth that are causing you pain. Because if I don't, then we can't properly tell what's causing you the pain. And I'm concerned you may have an abscess or you may have an infection. And without taking these x-ray or that x-ray, we don't know. So in that case, you see how taking the checkup x-rays are different than if a patient's in pain? If you're confused with that, please let me know, because there is a clear difference on that. You know, even if the patient's in pain and they don't want you to take the x-ray because they say they can't afford it, or they've been exposed to a lot of radiation, or they don't want x-rays, then if they're in pain, my conversation with them will change. And I'll simply say, the only way that we can get you out of pain is to take this x-ray, because we don't know what's causing that pain until we take the x-ray, you know, plain and simple. I mean, of course, I'll say it in a very nice way. And ultimately, they could still say no, but they need to know all of the facts, and patients need to know and trust you as to why you're taking the x-rays. They would probably trust you more than the dentist in some cases. It is hard to say, but you know, some of those patients out there, which I'm sure you've seen them, they feel that the dentist is just charging them and treating them for things that don't need to be treated. I've heard all kinds of things, but there are patients out there that actually, you know, trust you and trust the dentist, which is excellent. But even when it comes to x-rays, they may be hesitant. So I do hope that that helps in regards to the x-rays, because that is honestly the most common question or statement that you will have from patients. And the way you handle it will make the difference between patients being upset and patients just saying, no, it's okay, every single time, okay? And last but not least, I will say to patients, you know, legally, we need to take the x-rays at least or at the maximum every 3 years, because if we don't do that, we could be missing out on a lot of things. And if you end up having a tooth infection or something horrible happens, which I hope not, but you know, if anything were to happen, it's up to the dentist to be making sure we're taking the x-rays every 3 years to ensure that that doesn't happen, or the dentist can get in a lot of trouble. And clearly we don't want that. So that usually helps them too. Okay, so enough about x-rays. Another common question actually that I get from a lot of patients, or not a question, but I should say a statement, is, you know, that probing that you do to check the gum measurements, I don't really like that, so I don't want you to do that. I don't know if you've experienced this yet, but there will be patients that say to you, the probing hurts, I don't want it. Now, we all know if we don't do the probing, we are missing a lot. Just because the teeth may look okay, light plaque and light tartar, if we're not doing the probing every so often, we are missing a huge component. And without the probing, we don't know if they, let's say, have early perio, moderate perio, or a more severe form. So you will have those patients that say that. But typically, They're simply saying no because it does hurt them. Or it's because they don't understand them or understand the probing. So when I see that happening, I will actually show them a picture that I do have in my room showing them sort of the tooth and the gums around it. So I take my little probing instrument and I use that picture and I say to them, think of your tooth and the gums as a turtleneck. Okay, so this little instrument here is in 3 millimeter increments. And I take this little instrument, so I keep on saying little, little, little. So I take this little instrument and I put it in between sort of your tooth and the gum. So think of it as a turtleneck. And I walk it along, and then this instrument helps to show me how far the instrument will go in, because the further it goes in, we don't like that. So that means that things aren't healthy. And your toothbrush can reach to about 2.7 millimeters at the most. So if we're seeing that this instrument is going pretty far down there, then that's telling us that there's a space of about 4 millimeters or more. And then we would have to change our treatment plan from that and use different types of instruments to help you, because when we're cleaning the teeth, we need to know where these pockets are, because if we don't know, we could be leaving a lot behind. So here you are spending your hard-earned money and we may not be cleaning properly. So this is actually helping me, So I actually say that. I say this is helping me and you. So if it's okay with you to make you as healthy as possible and to get the most out of our cleaning today, I do need to check to see where the gum pockets are and how far they are. That usually works for a lot of people. I may take it a step further and say, you were quite sore the last time, but it's because you had a lot of plaque and you had a lot of tartar. You have less plaque and tartar today, so it shouldn't be as sore, if not sore at all. And, even if that's not necessarily true, if you see they have just as much plaque and tartar as last time, a little white lie can't hurt, because as soon as they hear, oh, so it may not be sore this time, they'll probably be okay. And you could even say, but if you are sore, please let me know and I can stop if you need me to, but just keep in mind that this is helping me and you to make sure your mouth is as healthy as possible. So you could use that on your patients too, but I find that helps. So if I put the onus on them and I say to them also that this is also helping me out, if I'm not taking these measurements down, I'm not cleaning the teeth properly, and then I feel horrible, right? So that's just something that I say. And depending on the age of the patient, that may not mean anything. Like if you're talking to a 20-year-old who's like, I don't really care, that hurt last time, I don't want you to do it, then that might not work. But I find if you're talking to the older patients, then they'll go, okay, well, she seems nice and I don't want to make things harder for her, so okay. But I suppose just try not to hurt them. But I know it's easier said than done, because if they have a lot of plaque and tartar and their gums are so inflamed, that's why it hurts, right? But they don't know that. Okay, you guys, so I'll leave with that for now, because I feel we did talk about a lot. So with these 30-minute missions, I take emails over the next few weeks of people who have questions. And I find the most common questions that people have, I make a note of them, and then I will talk about them. So if I didn't answer one of your questions today, then please feel free to email me, and I would be happy to help. And you will all see this 30-minute mission. I like to do these missions every few weeks. So please, if you have questions, please let me know. And I will catch you guys all in the next video.